So today we will discuss some new age cutting edge technology for treating osteoarthritis of the knee joint. So as we know, there is a bone on top that is called femur and there's a bone below that's called tibia, and when there's a gap between the femur and tibia, the joint is reduced and there's new bone formation and there's fluid collection or inflammation, and that process is called osteoarthritis. So traditionally when we see osteoarthritis, we basically have 3 or 4 kinds of treatment, right? The first type of treatment is conservative treatment. In conservative treatment, what we do is we give some medicines, we do some physical therapy, physiotherapy, and in the hope that the muscles around that will strengthen and the inflammation will temporarily quieten down. But as we all know, a lot of these medicines beyond a week or 10 days are almost useless, and in fact they harm you more because they're all analgesics. And physical therapy helps to a degree but not beyond a point. The other extreme of treatment, that is almost the gold standard for very advanced osteoarthritis, is complete knee replacement. So in knee replacement, what we do is we remove this part of the bone and this part of the bone and put an artificial joint and fix it, and it's a plastic joint, hence it becomes a pain-free joint. However, knee replacement is reserved for grade 4 osteoarthritis mostly, number one. Number 2 is knee replacement is a major surgical procedure. It lasts about 2 to 3 hours at least, and you have a hospital stay, there has to be operative fitness. It's a major procedure and it's a good procedure, but it's a major procedure. Now in between one end which is medical therapy and the other end which is knee replacement, there are some minimally invasive procedures. Some of them are intra-articular injections. That means you go into the joint and inject some steroids or PRP or hyaluronic acid. Almost all the time these are temporary treatments. Steroids effectively don't work, and in fact they're officially harmful. There's a lot of papers that are published. To a degree PRP works, but that's very, very temporary. So intra-articular injections almost always don't work to a permanent degree. Now we have a new procedure now called genicular artery embolization, where we go into this vessel that supplies the knee joint and go into each one of these vessels using angiography and inject some medicines into that particular inflamed area. So we identify the inflammatory vessels, and they're called moya vessels. We identify them and we inject some medicines into that, which quietens the inflammation. This reduces the pain, inflammation for more than 4 to 6 hours. It's widely used in Japan, US, UK also is caught on big time, and it works very, very well. So somewhere in between here, between medicines and TKR, is a very effective and a latest cutting edge technology procedure called genicular artery embolization, where by a small injection into the femoral artery, we can reduce the pain and stiffness and inflammation for a long time. It's an excellent procedure. It's a daycare procedure. It's done in 30 to 40 minutes. After 2 to 3 hours, you can go home. No cutting, no stitching, no anesthesia. It's a very good procedure without all the long-term side effects of knee replacement. Also, in early osteoarthritis, which is grade 2, grade 3 osteoarthritis, knee replacement is contraindicated, which means you should not be doing it. In those cases also, genicular artery embolization works very, very well. And also in stage 4 osteoarthritis, even when knee replacement is indicated, if there are other medical comorbidities like blood thinners or heart problems, which all of which will prevent you from getting a knee replacement, in those cases also this works very, very well.